This is North Dakota Legislative Review. I'm Dave Thompson. Thanks for tuning in. As we wind down and end the legislative session, we're talking about some of the issues that have come up and some of the issues that have been settled. And our guest today is West Fargo State Senator Judy Lee. She's a Republican and also chairs the Senate Human Services Committee. Senator, thank you for being here.
Thank you for inviting me.
So we wanted to go over it because Human Services is a huge budget. So
Exactly.
You had a lot of things to work out in your committees in the Human Services budget. Can you kind of give us a thumbnail of what's in it?
Well, there are a variety of subjects that we cover because we really do deal with issues from before birth until after death. And so we've had some excellent programs talking about children. Child care, as we've heard, is a big issue out west, particularly. And there is a child care bill which was passed that is for the first time going to provide some sliding scale subsidies for low and moderate income families. And that not only will help them afford good child care, but it'll help the good child care providers raise their rates to where they have to be in order to be able to stay open. Autism, a really big issue, a new program for us. We're really excited about the start of this pilot project. That would be another really good one. We have programs also that we're pleased about dealing with vulnerable adults, people who have been either financially or physically abused or both, or neglected. And we're putting additional funding into providing the personal services needed to provide for their safety and for guardians to be appointed for those who are below the 100% of poverty level and may not have any family members. So we've tried to do some things that serve a lot of people in the state.
I'd like to start with something that did happen that may have surprised a lot of people, and that's the Medicaid expansion. That was part of the Affordable Care Act. It probably is a fair statement to say that not many legislators like the Affordable Care Act, but did go along with the Medicaid expansion. Can you explain how that came about?
Well, the more one learns about the federal health care reform, the more one sees that there are problems with not doing some of the things that are expected of the states. The original federal health care reform law assumed that all states would have Medicaid expansion, and as a result, that would cover all of those that would be the lowest income, below 100% of poverty. The benefits for the exchange, where people will be able to buy insurance subsidized by taxpayers up to 400% of poverty, start at 100% of poverty. So when the Supreme Court ruling came through last summer, and it said the states could make up their own minds about whether or not to expand Medicaid, that was a fine decision. But the state is put in the position of saying, okay, if you make $16,000, you can pay $320 a year for your insurance policy. But if you make $14,000, you're going to have to pay $3,000 or $4,000 a year because you're below 100% of poverty as a single person. And as a result, you get nothing from us. So we have to think about those folks who are the poorest of the poor having proper coverage. We have never covered childless adults in North Dakota. But there are other things that were very important to other different factions of the legislature. Employers were going to have up to $3,000 per employee fines if they didn't provide insurance if they had over 50 employees. Individuals who are not purchasing coverage for themselves and who aren't getting it through their employers were also subject to increasing fines every year. And so there were a variety of reasons why business was extremely interested in seeing this move forward, because it provides some options for coverage and also to prevent some of the penalties that were coming down. So we think it's a good thing.
So you were able to convince people that it's a good thing to do. You may not like the bill, but there are some benefits that North Dakotans can receive from doing this.
There will be a lot of benefits received, and I think it's important for all of these reasons to have done it. But the interesting thing is, because of the various reasons there are to support it, there were enough people supporting it to pass it. One of our Senate colleagues said it was kind of like the spinach bill. I don't really like it, but I know it's good for me. And that was kind of the way it is. There are good things in there for a variety of factions, and it'll be good for North Dakotans in lots of different places.
I'd also like to get into this autism disorder pilot project. Can you expand on that a little bit, because that is something new in North Dakota?
Yes, and I'm very proud of how that has turned out, because it represents some very collaborative work by legislators along with experts in the field. Autism spectrum disorder, which I'm going to call ASD from now on, is something that touches so many families. We've been told now it's about 1 out of 88 children nationally. So we have had a waiver for some time with the Department of Human Services, which serves children up to the age of 5, but only those who qualify for institutional care. And 40 years ago, or 50 or more, they would have perhaps been in the developmental center. But today, they're being cared for by their families in their homes, and they're getting services to help them lead as good a life quality as they possibly can. But for, excuse me, but for those children who might not qualify for institutional care, there haven't been any services provided. So this pilot project voucher is going to provide services for those children who are not in the waiver, but who go all the way up to the age of 18. And we are only supporting those programs that are already determined to be medically effective. There are other kinds of treatments and interventions that may be useful for some children. But in order for us to just have a focused initial program that we can contain the cost on and really evaluate in this biennium, we started with the ones determined to be medically effective, and we are limiting it to children under 18, and we are expanding the service of the waiver when it's renewed this fall to children up to 8. So the kids who are aging out at age 5 will continue to be served through the next 2 years, which I think is great too. We're going to have training, which I think is kind of a neat deal. Not only parents and teachers, but we're going to provide training or implement, the proper people will be planning, training for child care providers who are taking care of kids before school age, and lunch ladies and custodians and secretaries and bus drivers and all the people who might interact with these children during the day, because they need a little instruction on how to recognize when a child is being stimulated in a way that's going to lead to some kind of behavioral outburst, and recognize maybe it's noise, maybe it's light, whatever it happens to be. They can help to get that child to a place where they can be calm and be happier as a result. So we have an extensive training plan that we were looking forward to having in place.
Would it be a fair statement to say we're learning more and more about autism, and that's why you can start having programs like this?
Exactly. We know more about it. It's a fast advancing science, but the unfortunate thing is we really don't know what causes it. But there is research, of course, going on all the time. We have some remarkable experts in this state. Pediatric psychiatrists, psychologists, other pediatricians who have spent years treating children with autism, and they were remarkable resources for us in our planning here. The legislators aren't all that smart, but we are smart enough to be able to talk to people who are really smart about subjects like this. And so their input and advice was invaluable in trying to figure out how to determine which programs would be covered and how to start.
So it's a pilot program, meaning that you'll probably look at the results or look at how well it's working after 2 years, and maybe down the road it might be expanded a bit?
Exactly. We'll evaluate it in 2 years and see where it's working and where it's not. We also will be collecting data on how many children there are that are professionally recognized as having ASD disorders. And we will know not only the numbers of children, but the range of services that might need to be provided. So we don't really know what to do or how to do it until we know how many people need to be served and what their needs are.
Do you know how many other states are doing something for autism similar to this?
There are some other states that have, and there are some that have made it very wide open as far as what kinds of treatments would be paid for, and they have been financial black holes. And so that has created some real anxiety on the part of some of the legislators because they wanted to make sure we weren't doing that. Those of us on the Human Services Committees didn't want to do that either. And that's why this is limited, and there are people who are a little disappointed that it isn't more broad in its scope. But we really felt it was important to start small, be focused, really recognize some good outcome information 2 years from now, and then decide whether or not to continue it, and I certainly think we will and hope we will, and whether to expand.
So that's the point, you take the small steps now.
One step at a time.
Bigger steps maybe later on.
Exactly.
Okay. Now you did talk about childcare, and I really want to get into that issue too, because that's been a maze of itself,
Yes.
the way that's gone through, but it seems like there's a product that has passed now that people seem to be pretty happy with.
Absolutely. There has been support over the last few years for helping child care facilities develop business plans, because often we have people who are skilled at the idea of child care, but they're not necessarily skilled about how to make it pay. And they don't want to charge high amounts because they know their families are sometimes struggling. So it's really been hard for some of them to financially stay afloat. So there are some excellent programs through the Department of Commerce to assist them with business plans. There is financial support in order to get them established. And now one of the main things that's going to be going forward, and quality programs as well. But one of the things that's being implemented now that is new, and Representative Robin Weiss actually deserves credit for this, is that there will be a sliding scale of subsidies for families based on income, up to 200% of poverty, I believe it is. No, it's median income, actually. That will be able to get assistance with paying for their child care. So we're not subsidizing the child care provider, we're subsidizing the low-income family so that they can pay for child care, and it will also help those child care facilities stay afloat because they'll be able to charge what they need to charge in order to stay in business.
Yeah, there's been a lot of talk about people who are, making so many thousands of dollars in the oil patch working for the oil companies may be able to afford child care, but in the service industries, the support industries,
Yes.
It's a lot tougher.
Absolutely. And so this is something that can help folks who are working in long-term care facilities and grocery stores and all of those places that aren't necessarily really reaping the benefits of the high salary jobs.
So why was that such a contentious issue at one point this time?
We were focusing in a different place originally. I mean, there were folks who thought that we should be subsidizing the operations of the child care facilities. And the concern was that we create another entitlement. So in the same sense as we just passed and had the governor sign today, the Human Services Bill, with increases in reimbursement for salaries for people working in nursing homes and such facilities, they didn't want to have another group of employees who are being paid in large part by the state through their employers. So this is different because the benefit actually goes to the lower income families who need the child care and not to the child care provider business directly. So it's enough of a philosophical difference to make it work better. And it's exciting to see how it fell into place.
And now finally it has fallen into place, and
Yes.
there's a study also attached to that too, I think.
Yes, there is. And another thing that we gave this baby up for adoption because we were talking about tax credits for employers to get involved because we think businesses need to be a partner. But that belonged in a tax bill because it was discussing tax credits for businesses. But this was done with the help of the tax department and several of the senators as well to develop a tax credit for businesses who might support facilities in several different ways so that they might be partners with child care providers, either directly or even purchasing slots for their own employees, and then they could subsidize their own employees the rates that need to be paid as well. But there are several options that we're hoping will attract some interest on the part of businesses in the state.
Well, not to put too fine a point on it, the 2020 survey, basically that was issue number 1 or issue number 2 in just about every survey that has been
Absolutely.
taken, is the need for child care.
Absolutely. Senator Anderson said in his district, which is north of Bismarck, that after tax reform and DUIs, child care was at the top of the list. And I think that his point is well taken all over the state. It isn't just in oil country that this is an issue either, but it's really critical there.
Now, since we're talking about some programs to help child care centers and child care centers cash flow, basically, you also had a loan program for medical facilities, especially in western North Dakota, who are struggling to keep up with their workload, struggling to have enough beds to provide as the population grows. What's the status of that now?
That was a circuitous and sometimes bumpy road, but it has turned out all right because the original proposal was to take money from the Strategic Investment and Improvement Fund, the SIF fund. And it turns out lots of other outfits wanted money from the SIF fund too, so pretty much it was getting depleted. But in the final days, the $200 million, which is supposed to be dedicated to school funding, low interest loans, was left intact, and there is $50 million for hospitals to have 1% loans to expand or improve their facilities, and that's a critical need out west, as you mentioned. And there is then a trigger for another 50 million to be available later. So it's a timed thing, but it's better than, not as good as we started, but way better than it was in the middle. So it turned out okay in the end.
But at least it helps them out if they need
Absolutely.
something. And then they don't have to go, as I think a couple of hospitals have tried to go to voters to ask for some money to expand.
And they've also found that these kinds of loans are not easily available through the banks. It isn't that these people are bad risks. We're going to be looking at loans processed through the Bank of North Dakota, and they aren't going to grant a loan to somebody who doesn't have the potential to repay. So we're businesslike about the way that's going, but there has to be a source of funds. And so this is going to be, we hope, a source of funds that will help those hospitals. Watford City is an example. I don't know that they're necessarily going to be one of those who request it, but they have had a severe impact on the amount of activity in their hospital and emergency room. And so they need to expand their facilities.
That being said, there was of course, what was described as landmark legislation in order to get some more money back into the counties. The whole idea of using 3 cities as kind of hub cities.
Yes.
Yes, and making sure that they have enough money for infrastructure and things like this. And then there's been a lot of money. I think it's a $1.1 billion price tag for that.
We passed this morning in the Senate the bill that covered 1358, which has a tremendous amount of impact on it's a billion, 1.1 billion, going for various purposes in the oil counties. Excuse me. And there are many, many different purposes. And there is actually a little hospital money in there too, as I recall. But that'll be really important because it's roads and other kinds of infrastructure. And we're also hoping to get it squared away so local public health units can have access to some of that money that's uncommitted because they have a big increase in demand as well. Schools, I believe, have an access point in that as well. There's just so many areas of need in that area, and we need to make sure that we've been able to settle down some of the problems there. Law enforcement, of course, another one. The Attorney General's budget had additional dollars also for law enforcement out west. Highway Patrol needs more folks to manage the traffic out there. So we've, I think, been very good about what we've done to make it better in the future for the West with all of the oil development there. We're pushing $2 billion with a B dollars for oil country, and isn't it wonderful that we're in a position to be able to do that?
Do you think the legislature is getting its arms around what has happened with the boom and all the complexity of it with the infrastructure needs, the healthcare needs, the human service needs? Is the legislature getting its arms around that now?
I think so. It's easier to sell fixing the roads, and we see that in our discussions in human services. But in the end, even though we didn't maybe get everything that the 2 policy committees might have liked, and we're not spendthrifty, we are careful about what we're doing, but we are particularly aware of the needs that exist there because they are brought to our attention. But the legislature in general is certainly supportive of this. We know that behavioral health needs are a tremendous issue all around the state, and there are certainly needs for additional counselors, for example, in the West. There are challenges because of more people and more stress, and families are working long hours, and sometimes part of the family's in another state or another community. And so for any number of reasons, domestic violence, addiction issues, all kinds of things like that that create other problems need to be dealt with, and we need to take care of that. So I think we're going to have some good outcomes as a result of the investments being made.
From your perspective, since you represent West Fargo, and West Fargo has had an interesting issue and interesting challenge, and it's a good challenge. As your population has grown, you've had a squeeze on your schools. Has the legislature done enough for school districts like West Fargo that have seen rapid enrollment growth?
We're waiting for the for the passage of the bill this afternoon or later today that deals with K-12 funding. So we're hoping that shakes out okay. And there was a separate bill having to do with rapid enrollment. We had 570 additional students this year. That's bigger than a whole bunch of this whole school districts in the state of North Dakota. And this isn't a new thing. We have continued for the last 6 to 8 years to have several hundred new students, additional students, I should say. every year. And you have to find a classroom for them, you have to find teachers, you have to turn the lights on and make sure the heat's working. So it has been a challenge, and our district has done a wonderful job of coping with this. We are a little short in what we need in order to deal with this. We're hiring 50 new teachers for the next school year. That's a really big deal. And so the legislature has been sensitive to that. They're trying to establish priorities. There's been a really big focus on what's happening in oil country. So I, from a purely selfish standpoint, for my own district, yes, I would have liked to have had a little additional funding for a district having as great growth as we do. There are several schools in the oil country areas that are also having significant growth, but the numbers of children are not as great. We passed a bond issue of $82.5 million in West Fargo a few years ago. We're building 5 new schools. That's a big deal, and we're paying for it.
5 new schools. People may not realize that because of all, as you mentioned, all the spotlight on the Bakken and what's happening in Northwest North Dakota, but really the economic growth in North Dakota is statewide. Everybody's seeing a part of it, and West Fargo has for years.
Absolutely, and the Red River Valley in general has a lot of high tech. The research universities are big contributors. Of course, the medical campuses are a really big contributor also to employment. And so that's it. The other thing for West Fargo itself is that we have a lot of land that is protected by Cheyenne diversion. So the residential growth areas at this time are within the West Fargo School District. And so if you're going to build a house, are you going to build where you know for sure you're going to be flood protected or not? Probably you're going to choose a lot that's in a neighborhood that's equally nice, that's going to be protected.
Well, you mentioned Cheyenne diversion just very briefly about Fargo diversion. Apparently there was language reached that was acceptable to at least diversion supporters in the water bill. And I was just wondering, what's your take on that?
That was an extremely important bill, just signed by the governor too. And it covers a variety of things all over the state, water projects in the southwest and northwest, Devil's Lake, of course, several different flood control and rural water projects. But for us in the southeast part of the state, it's the flood management in that southeast area. So the Hickson, Bakke, Oxbow area will have the ability to have flood protection built that will create significant flood protection for them earlier than some of the other places. Retention through the city of Fargo that'll prevent some of the additional water from having to be held south of town, and also some protection from overland flooding in the north and west areas there. So some good things will happen, and we're very grateful that the legislature did come to some terms with it so that we can proceed. Because and one of the things that has led to its support by pretty much everybody now is that the people who are in the outlying areas will have a seat at the table when the discussions are being held and when the reports are given.
So you may not be able to reach, agreement, but do you think you could reach some kind of consensus?
Absolutely. I think it's been reached.
I have to ask you this, and it has to be back on Human Services. Your committee works a lot with Maggie Anderson.
Yes.
And Maggie was the interim director of Human Services. She took over when Carol Olson retired. And now the governor has appointed her as the director of Human Services. And I just wanted to get your take on that. What do you think?
I think she was an absolutely fine choice. She's had 3 jobs. She was a Medicaid director, which is a full-time job on its own, and one of the best in the country. I mean, I go to meetings and they say, "How's Maggie Anderson?" She also was the interim director, which is a full-time job, and she's dealing with all of us goofy people in the legislature during the session. So she said herself that she hasn't seen her family much for the last 8 months. But she's an excellent choice. She's extremely familiar with the department and the programs. She knows the players all around, and she's very credible with the legislature, which is an extremely important thing. When she says something is the case, that's the way it is, and we know we can trust and believe her. And so I look forward to excellent leadership in the Department of Human Services with her at the helm.
Well, in the few moments we have left, I would like to ask you, what do you think people will remember about the 2013 legislative session?
Well, I would hope that the first thing is that some really good things came out of this in the end. Because there are good services for infrastructure, good tax relief. We haven't talked a lot about that because other people have probably visited with you about that. But there will be some exceptional, about $1 billion worth of tax relief, and some excellent infrastructure and other improvements for the oil patch. But I hope that they pay attention to that and don't get caught up in the occasional brouhahas that especially get covered on blogs and Facebook and media other than yours, because some of those little things maybe never happen quite like they were promoted, and they never are the important part of the discussion. When I go home, I enjoy spending an hour after church talking to people who want to know about what's going on, because they can't always find out what they'd like to know. And so it's a pleasure, I think, for any legislator to go home and to visit with the folks from home and answer questions and find out what's on their minds, and assure them that we're really not goofing off here and just being foolish. We really are trying to address in a serious way, without taking ourselves too seriously, the things that need to be done here. So I would hope that they think in the end that we've done a good job.
Thank you very much for being here.
Thank you.
Our guest today on Legislative Review, State Senator Judy Lee of West Fargo, a Republican and chairman of the Senate Human Services Committee. For Prairie Public and Legislative Review, I'm Dave Thompson.